Welcome to Veterinary Horizons, the podcast where we explore the future of veterinary medicine one breakthrough at a time. I'm David Martinez, your host and the Vice President of Specialty Veterinary Pharmacy. Today we welcome Dr. Scott Driever, current president of AAHA, and a veterinarian known for his expertise in small animal surgery and compassionate client care.
My team has the knowledge and has the ability to go in there and really have those really good, conscious conversations with clients. And if they've got questions, I'm there, but trying to utilize their brains.
Each episode, we'll sit down with leading experts, innovators, and thought leaders from across the veterinary field to discuss cutting-edge technologies, emerging treatments, and the evolving challenges that are reshaping animal health care. You've been in business for 24 years, so you kind of know what you're doing.
In theory.
Yeah, I like this topic because I'm also a business owner, and so I've kind of been through challenges and wins. So what's been your biggest challenge that you've come across in the past 24 years as being the owner of a clinic?
Culture is probably the biggest thing, and that is something that I feel very, very strongly about. And as you know, as a business owner, it's not something you can just say, all right, team, here's our culture, go culture, and
yes.
Go team.
100%.
It is something that you have to nurture and massage and really focus on and work on a daily basis. But other challenges that we've got is it really comes down to workforce efficiency. I find myself being the quintessential Gen Xer trying to just do it all myself and getting it done. I know it's going to be done. And in my opinion, it's going to be done right. But at the end of the day, I don't need to be the one to wear all the hats. And so I am consciously making an effort to utilize my licensed technicians to trying to get them to the fullest extent of what their licensure allows in Texas by client education and just doing more things and taking those items off of my plate so I can go do other things and see more patients and just do a better job.
As a business owner, that's been the biggest challenge for me has been letting go of certain tasks, like you said, and really trusting our team to do the things that they're also licensed to do and take them off of our plate so we can grow the business. I've learned that being a business owner is essentially an education within itself. The longer you go, the more experience you get, the more you learn. But you got to be open to the learning part too, right? So technician utilization. What is a couple of big key things, like low-hanging fruit for clinic owners that they could do with their technicians, they could implement to utilize their technicians in a way that is going to make a big impact for them as far as saving them time? What are some low-hanging fruit for business owners?
For me, the biggest thing is it comes back to client education.
Okay.
My team is smart. My team is licensed. They are very capable of having just as good, if not better, conversations with those owners about their pet's disease or what's going on or what to expect or things like that I don't have to be the one in that exam room an extra 10, 15, sometimes 20 minutes talking because, as you know, I do enjoy talking and I can talk about anything with anybody. But that doesn't mean I need to spend time in the exam room doing all of that. My team has the knowledge and has the ability to go in there and really have those really good, conscious conversations with clients. So it really cuts down on my time and I can go finish up my records, make other phone calls or things like that. And if they've got questions, I'm there, but trying to utilize their brains.
Yeah.
Not just their hands, not just catheter placements, not just drawing blood, not just giving injections, but it's usually utilizing their brain.
Yeah.
That's what they're trained for.
In that certain situation, do you ever find any kind of kickback from pet owners that are like, no, I want to talk to the doctor?
Infrequently.
Okay. Yeah.
And when,
that's good to know because I'm sure.
There's always going to be some pushback from somebody.
Absolutely.
Even if you do a perfect job, you're never
Yeah.
going to make 100% of the people, happy 100% of the time. But when I do that, my team has been trained that I know the answers that they're going to give because they're the answers I would have given.
Okay.
So I can just, when a client says, well, I want to hear it from, Dr. Driever, I want to hear a doctor, I go in there and just tell them literally the exact same thing, the exact same way. And that also proves the point that everything my technician just explained to you or just told you is 100% spot on. And because they're the exact same words that are coming out of my mouth right now.
And I'm sure that's probably, 1 out of every 50 customers. It's probably not an uncommon
Not
thing.
even.
Yeah.
It's infrequent, and it depends more on the client than the conversation.
Okay.
I find.
So are there some specific things that they're licensed for that they can do that maybe your average pet owner doesn't quite know about, or and also that would make an impact on on teamwork and productivity?
So when they get their license, they are allowed to, for certain things like close surgical wounds and do things like that.
Okay.
We typically don't do that in my practice. That's still a doctor thing. But there are a lot of practices, again, to utilize techs to the fullest extent of their licensure. Yes, there would be closing, not creating, but closing surgical wounds. They would be, just doing more things. They can't prescribe, they can't diagnose, they can't give prognoses, and they can't create surgical wounds. But they can do just about anything else.
Okay.
And it's leveraging their time and their brains more efficiently, which is what makes my practice run better, but also makes my life easier.
Okay. And you also mentioned, their training, of course, and talk a little bit about what kind of continuing education, continuing training. I know you mentioned that you weren't even going to be coming to this conference. We're at Southwest Veterinary Symposium, by the way. But you had 2 technicians that really wanted to come, have never been. How does that impact productivity, bringing them to events like this and having them sit into CEs and
Well, just like when we go to meetings, I mean, your energy gets revitalized, your battery gets filled. You come back from conferences or from meetings or things like that, and you're energized again. Yes, it's fleeting. Yes, it wanes over that first week or two, but it really does re-energize you. And when they asked me if they could come to this, I was like, heck yes. I was pleased that they asked, and I'm excited. And just seeing them, we've been here for almost a day now, and just seeing the excitement on them, on their faces, and when they talk about what they just learned about or things like that, it's absolutely fantastic, and it makes me realize where I was earlier in my career, that I forgot that energy of coming to something like this. I come for the social. I know people. I talk. I forgot what it was like to come to something like this for the first time. And so I'm able kind of reliving that through them vicariously through my 2 technicians that are here. I'm able to see that, and it makes me excited again.
That's awesome. Yeah, that's great. I think, all clinics should, embrace that and bring their technicians, get them out of the office, get them, an opportunity to learn and grow, and then bring that back to the clinic. And it just makes things more efficient, right? Do you normally, so when y'all come to a conference, do y'all come with an agenda? Do y'all come with learn this? How does that work?
For this one, because it's their first time, I said, all right, let's pull up the proceedings like 3 weeks ago. Let's pull up the proceedings and let's talk about it. Let's look. Because some of the things that you might want to go to might be, even though the title looks good, it might be a large animal thing, or it might be not exactly what you think. So we sat down and kind of looked at some of that, but there was no agenda. I told them, learn about what you want to learn about. This is about you getting, continuing education. This is about you getting excited about your career that you have chosen. And no, they're having fun.
Yeah. And I think generally they'll make great decisions. They'll know, I may have a weakness in a certain area, and here's something that can maybe help me learn more about that weakness and how to improve, how to make me more efficient. But I like that. I like your approach. I like your approach of sitting down and going through the agenda, because I think it could be actually very helpful. Anybody who's come to a lot of symposiums and a lot of CE lectures, it's kind of nice to sit down with somebody who's done this for a long time and give you a little bit of guidance, because you could get, select something that may be like, well, maybe I shouldn't have done that. Maybe that might not help in certain areas, or it might not be helpful at all for what we do at the clinic
Sure.
or what have you. So yeah, I like that approach. That's really cool. What about on a local level? Any other type of training that you provide for your technicians, besides maybe CEs, things like that?
There's going to be the occasional lunch and learn. We have
Okay.
the occasional day where we'll take a couple hours and maybe have a VTS specialty person, like a dental technician, come in and
Yeah.
kind of review processes and reviewing procedures and things like that. So there is some kind of in-house stuff that we'll do. We are fortunate to live in a big enough city where CE is plentiful, put on by the differing, drug companies or things like that they can get some CE locally. But it's learning is important to everybody.
Let's talk a little bit about president of AAHA and your journey to that. I mean, we've talked a little bit, off mic about how you can help, and how you can volunteer. So talk a little bit about that, how you even started in this volunteer space.
So I'll back it up a little bit further before AAHA. And I had a very dear friend of mine in 2003, kind of a mentor of mine, tell me, hey, you should be involved in the Houston or the Harris County Veterinary Medical Association. You should think about getting on the board. I think you'd be good for it.
Okay.
Well, that's how all things happen. Fast forward to 2008, and I'm now president of the Harris County VMA, which was fantastic. Made a tremendous friends, met a ton of people, and just had a really, really good time doing that. And then fast forward a few years, and I become sole practice owner, and I'm looking for help on how to be a practice owner. Because being a veterinarian is difficult enough, but when you throw practice owner, businessman,
Yes.
CEO, team leader, cat herder, everything on top of being a veterinarian, it gets overwhelming pretty quick. So I was able to turn to the American Animal Hospital Association standards, guidelines, and they really helped me. And I started going to their conference in 2016, right after I bought the hospital. And in 2018, I was silly enough to ask the question, how can I help?
Okay.
Fast forward 6 years, and I'm now president of the board. But it has been a tremendous experience, and it's been very, very exciting and fulfilling because I don't feel like I'm just helping my hospital, but I'm helping the profession. And everybody's goal should be, whether you're a business owner, whether anything you do, you should always strive to leaving whatever it is, the world, your practice, your business, leave it better than you found it.
Absolutely. Okay.
And that is what I have tried to do with everything I've done with the practice, with being part of AAHA, everything. I'm trying to leave it better than I found it.
What are some of the things that you're excited about now that you're president? Do you have any specific initiatives? What is the main passion that you have going in, a passion project, I can say, going in as president?
I don't know necessarily if I have a passion project. As far as the game plan, I'll leave that to our CEO and amazing executive team at
Okay.
AAHA. As far as being president of the board, I'm in charge of having the board having a direction, having a vision for the association, and verbalizing and explaining that vision to our CEO and having them effectively carry out that vision.
Okay. Yeah.
So that's my job, and that's kind of what we do. And
Okay.
we're very, very proud of our standards and guidelines. We are currently reviewing our standards right now. We've got a director of standards now, and we're kind of going through everything, just making sure everything's in alignment with everything else. And we're still churning out our guidelines.
Yeah.
And our tech utilization guidelines a few years ago, very well received, and I'm very proud of what we do.
Oh, okay. So going back to tech utilization, AAHA has some tools that can help out with implementing some of this.
We created a task force a few years ago and actually developed technician utilization guidelines. And it is a guideline, not a standard, anything like that. But it's just guidelines on how can we use our techs more efficiently to do a better job, provide better care, and take some of the burden off of the veterinarians so we don't, get home at 8 o'clock at night after a full day and get back to family time. And
I think that's resource number one. I mean, I like that. Here we are talking about tech utilization. AAHA has created these guidelines that you can use. I think that would be a great starting off point for veterinary owners, practice managers to implement some of those things. I always find when I go to a CE or when I'm doing anything, I always feel like if I could just take one thing, maybe if I can implement one thing, what would it be? Can I get some low hanging fruit that will make a big impact? And it's a good jumping off point, So if you're a young veterinarian and you may be asking yourself like, how can I help? What would you recommend a good starting off point? What one little thing should they be considering doing to get that giving back started in their career?
Step one, find your local VMA, be a member, go to meetings. Yes, you're going to get some CE, but more importantly, you're going to build a network. You're going to build a team. You're going to build friendships, but you're going to get plugged in to your local veterinary community. That's step one. And then if you decide to sit on the board of your local VMA, whether you want to go to your state, like a TVMA, or whether you want to go to a national, an AVMA, or an AAHA, or things like that, get involved.
Yeah.
That's the easiest way, number one, to grow professionally, but it's also a very easy way it goes back to, circling back to, leave it better than you found it.
Yeah.
Sitting
that's
in
good
your own
advice.
little island of a hospital, you can do amazing things, but branching out and developing that team, not just your internal team of your support staff and your technicians and CSRs, but your external team, other doctors, other people that can become mentors and friends. Veterinary medicine is a team sport.
Yeah, I like that. Okay, yeah, and I can speak to, in Houston, I think we're a little spoiled. Harris County Veterinary Medical Association, they do a great job. We've been sponsors of them for a long time. We love going and exhibiting at their conferences or their little, I guess they're CE meetings. I wouldn't call them quite conferences, but they're small, they're intimate. You get to meet everybody. So like you said, you create a great network of colleagues. A lot of veterinarians that use our company, we've met there, and they're very appreciative of us being there, and likewise. So yeah, I think that's a very good starting point. Just simply go to a meeting,
Plug in.
Yeah,
Just plug in.
Plug in. Absolutely, very easy to do. And worst case scenario, you get a free dinner out of it and you get some CE. But I think you'll find that eventually you go to enough meetings, you start to say, well, I want to get involved. I want to help. How can I help? How can I help organize? Let me take maybe the burden off another colleague, or give another colleague a break, and I can help out and take over. And then it just kind of steamrolls from there. I'm in a very similar situation on the pharmacy side. That a colleague of ours came to me and said, hey, you should join the board at the Alliance for Compounding Pharmacy, which is an organization leadership organization for pharmacies. And I'm like, what can I do? And so he's like, I think you'll be great. You have an expertise that we could really use, and you could really give back to the compounding pharmacy industry. And so I'm like, sure, I'll do it. And then you got to just kind of jump in, and you'll find your way. I have one last little topic I want to touch up on is Boy Scouts. I don't know, are you still active in the Boy Scouts? You've been a assistant?
Tangentially. I've been super involved since 2010.
Okay.
My youngest son is just about to turn 19.
Okay.
So he's been out of it for about a year and a half, but we're still involved, but we do a lot more on the adult leadership training side of things for the Boy
Talk
Scouts.
about that. I found that very interesting. Yeah.
So my wife and I both are super involved in the adult leadership part of Boy Scouts. And there's a particular training that anybody that's in Scouts might have heard of, Wood Badge. Being a leader is not just showing up and making sure stuff gets done. Being a leader is leading by example. Being a leader is answering questions not by saying, you go do this, but by saying, let's go do this together. Let's figure this out. Let's create whatever we need to do. In the Boy Scout training, it teaches you how to have a vision effectively, how to create goals to reach that vision, which I have used as practice owner. I learned these skills in Boy Scouts, but I've used them more in my professional life than I ever did in my scouting life. Teaches you how to provide and receive feedback, which is not a easy skill for most people. But part of being a leader is learning how to be a leader, learning how to be a more effective communicator, learning how people receive information. And it's meeting them, seeing them. And there are thousands of books out there on how to be a leader and how to have crucial conversations and things like that. But learn. Never stop learning. When I was a young doc, I was so worried about missing a medical diagnosis that all I focused on was the science. And then when I started focusing on the me as a leader, as a mentor,
The human aspect of it, yeah.
the human aspect, the softer skills, as it were. I love it. And you talk about a work in progress. I mean, I'm living proof that we are never done.
Yeah.
The person I am now is not the person I was 5 years ago, not the person I was 10 years ago, definitely not the person I was 15 years ago. And I'm actually proud of that.
That's awesome. I love that.
I'm not done.
I love that. I think I like that this Boy Scout leadership thing. I'm going to look into it myself.
It's amazing.
Yeah, that's awesome.
It's a great training.
My last question is, what's on the veterinary horizon for Dr. Driever? What do you got going next? I mean, I kind of know a little bit of the answer. You just started as president of AAHA, so that's on the horizon. Anything else going on?
Anything else? No, not really, because president will take up, and being full-time veterinarian will pretty much take up most of my free time. I am fortunate enough where I do get to travel a little bit with the AAHA presidency. So I will be traveling to some of the larger trade shows and conferences and conventions and things like that I don't typically get to go to. So I'm kind of excited to do that. And then after that, I haven't figured it out yet. I don't know. My wife and I are trying to figure out what we want to do, but I've got such an amazing network of friends. I've got such an amazing professional network that once I roll off the AAHA board in 2 years, I'm not leaving.
Yeah.
I'm not going anywhere. I'm just going to have to figure out how I can best use that network to leave it better than I found it.
That's awesome. And Dr. Driever, if anybody wants to reach out to you, what's a good place to reach out to you, contact you, get your advice?
If they want to reach out, easiest way to do that is call me at the hospital. That's the Animal Hospital, Highway 6 in Sugar Land.
We'll put all that in the show notes, but that's all. Okay.
There you go.
Fantastic. Dr. Driever, it was a pleasure
This was fun
talking to you. And again, thank you for coming on Veterinary Horizons.
Thank you for having me.